I mean, if we really do believe that children are our future, why does only 4% of cancer research funding go to pediatric cancer?
1, 2, 3, funk it.
My darling, I love you, 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 I love you.
Now, that alarming statistic is according to the National Cancer Institute's funded research portfolio. And this kind of lack of funding has contributed to the creation of numerous nonprofit organizations to support pediatric cancer research. Vastly different from cancer in adults, pediatric cancers oftentimes require extremely intense therapies, partly because these cancers tend to be fast growing and extremely aggressive. According to the World Health Organization, pediatric cancer, unlike adult cancers, really have no known cause. So let's talk a little bit about childhood cancer. It's the second leading cause of death in children, only second to accidents, and the leading cause of death by disease in children. Leukemia is the most prevalent pediatric cancer, followed by brain and spinal cord tumors. Over 95% of pediatric cancer survivors end up with significant health issues as a result of the current therapies today, signaling we need less toxic therapies. Honestly, it's a tough reality many parents and caregivers have to face when they're faced with the decision to push forward with this extremely toxic therapy that can end up in fertility issues, bone development issues, lifelong organ issues, and the potential for treatment-related secondary cancers. Our daughter Ella was eventually diagnosed with stage 4 high-risk neuroblastoma. Neuroblastoma derives from immature nerve cells in the body, most commonly in and around the adrenal glands and kidney. Stage 4, because by the time of diagnosis, that had already metastasized to her, the bone marrow in her femur and her lymph nodes. And high risk because Ella has a gene mutation called MYC, which basically means it's more aggressive. Neuroblastoma is the second most common solid tumor in children and by far the most common cancer in infants. The average age of diagnosis is roughly 2 years old, and in about 2/3 of cases, the cancer has already metastasized. Specific to neuroblastoma, many kids don't show obvious symptoms. It's only after diagnosis does a parent look back and go, man, was that constipation, the result of the tumor pushing on her kind of bowels, or that time she was running up the hill and got out of breath, or, she sometimes would sweat at night. Like, my mind was just racing with what did I miss, and in the majority of cases, the telltale sign was there's a sudden lump. What seemed like it came overnight, a sudden lump in her abdomen, which was scary. Some parents will talk about their kids having leg pain to the point of just not being able to walk or dark circles around their eyes. But with Ella, she was seemingly normal outside of what we were told by the pediatrician, normal, toddler issues. I remember after Ella's diagnosis wondering hey, why don't pediatricians check blood pressure at this age? What's preventing them from screening for cancer in this way early? It seems like a pretty non-invasive. Basically, the answer I got was that there's just so many variables with checking blood pressure at this age. There's so many things that can elevate it. And, even the American Academy of Pediatrics doesn't recommend checking blood pressure until about 3 years of age. So for me, it was like, man, how could this have been caught sooner? And the reality is, in many cases, you just don't know. It can't. And it can come from nowhere. Kids could be born with this and it doesn't manifest until later, or boom, here it is. And by the time you see, here it is, a lot of times it's too late. So what? I mean, what's the purpose of all of this? The reality is, unless pediatric cancer touches you directly or someone close to you, someone you know, there really is no awareness about it. You know, you go on, at least I know I did, you go on with your life, doing the best you can as a parent to take care of your kids, keep them healthy. And you don't think about it. You don't want to think about it. It's not a topic that you're like, oh, let me go think about childhood cancer. Or you're in a grocery store and they ask you, hey, would you like to give $2 to St. Jude or something? Sure, here you go. It's out of sight, out of mind. I mean, even pediatricians, the majority of pediatricians don't see kids with cancer and don't even look to screen for it, just because a lot of them don't deal with it, haven't had that experience. Throughout this journey, I've learned to trust my mom instincts, but at the same time, if you miss something because you can't catch everything, don't beat yourself up about it. To my fellow cancer moms, dads, caregivers, I commend you. You are absolutely amazing. I know in this journey, at times it seems impossible, but keep in the fight. You did nothing wrong. I'm here with you. Know your power as a parent, because you are more important in this journey than you even know. As always, hit the subscribe button to follow along and receive the latest episodes. Ella Strong, peace.